This week, the number of confirmed cases of coronavirus worldwide hit 200 million. It's a staggering figure underscoring the global impact of this virus. But while wealthy countries have been able to protect many of their citizens with vaccines, poorer nations continue to lack access to life-saving shots. The World Health Organization is calling for rich nations to delay rolling out booster shots until at least 10% of the global population is vaccinated.
What we're calling for is, for at least the next 2 months, is a complete, global solidarity around the goal of catching up the rest of the world to, in terms of its immunization coverage. We're in a pandemic. The entire world is in the middle of this, and as we've seen from the emergence of variant after variant, we cannot get out of it unless the whole world gets out of it together.
It's no understatement to say that the course of the pandemic depends on the leadership of the G20 countries. We need everyone's cooperation, especially the handful of countries and companies that control the global supply of vaccines.
But tonight, there are no signs that wealthy countries plan to heed the call of the WHO. Now, this is important because poorer nations, more than a year and a half into this pandemic, still do not have access to those life-saving vaccines. Now, those countries awash in vaccines, they are contending with another problem, vaccine hesitancy. In the United States, as the highly infectious Delta variant spreads, hospital COVID units are filling up with patients. Almost all of them are unvaccinated. Some of them are making appeals from their hospital beds, like Travis Campbell from Virginia.
This place was basically empty with COVID last week, but now it's full. So it is growing and it is getting stronger. Hate to hear, lost a couple acquaintances the past 24 to 36 hours. COVID, this Delta strain, that's something else. I would ask you, if you thought that you had to sit down and plan your goodbyes and funeral, or go get the COVID vaccine, what would you do? I'd hope to God that all my friends and family would not say, somebody hand me a piece of paper and a pen. That's a sobering thought, of which I have done. I have planned.
Yeah, it is not easy watching that, but we thought it was important to share with our viewers. My next guest tonight is an expert on the nexus of public health, infectious diseases, and humanitarian aid. Dr. Niels Henning from the Mount Sinai Global Health Center joins me now. Dr. Henning, it's good to have you on the program. Before we talk about the vaccines and vaccine equality, I just want to get your reaction to what we just showed there. This patient in the United States admitting that he could have prevented being there.
I think my first reaction as a physician is that sick people should really concentrate on getting better, or not on putting messages out while they are sick. On the other hand, I think it is important that people who are not vaccinated are confronted with the realities, and I think there is a role to play for community leaders and others to reach out to convey that message.
Do you think that these stories of people regretting not getting vaccinated, do you think it will persuade people who are hesitant now to get the shot?
I think it might persuade one. I mean, obviously, it is an issue of trust. And in the end, it is important. I think developing trust is probably more important than scare people. So I think the message should kind of concentrate on really about the importance of the vaccine, what the vaccine is doing, how the vaccines were developed, that the vaccines are safe, and does it really protect you, and that it also protects others. I think those are the messages that we should concentrate on. But obviously, a personal statement, and that's one of a very powerful statement we just heard before. They are also very important, and I think they also play an important role.
What do you make of these vaccine mandates that we're seeing now being introduced in the United States? We know lots of companies are requiring people to be vaccinated, and New York City has become the first major urban area that's going to require people to prove that they've been vaccinated if they want to go inside restaurants and bars or gyms. What do you make of that? Could it backfire?
I mean, yes. I mean, as here in New York, as you said, and even here at Mount Sinai, where I work for our students, we also mandate them to be vaccinated. No, I think it is a very good idea. I think it does make a lot of sense. I think like in restaurants, in bars, and clubs, and venues, it protects the people who work there. It also protects the other audience members, and also it kind of protects their extended networks. It protects everyone, you know, like when those people go home, they might have small kids at home who might not be able to get vaccinated yet. So it protects the whole community. So I think it's a very good idea.
And do you think that the public information campaign about these breakthrough infections, is it helping or hurting the vaccination drives?
Well, I think it is important that the information is brought over the right way. I mean, there are breakthrough infections, but the people, they get infected, but there's a difference of being infected and being severely sick and being admitted to the ICU. At our hospital, the patients that we see are admitted to the ICU. They're all people who got not vaccinated. And yes, we do test people positive who are vaccinated, but they are not severely sick. So I think that is really, that's a really important message.
And this Delta variant that we're dealing with right now, particularly in the United States, what does it mean for this goal of 80 or 90% in reaching herd immunity? Does it just shatter that equation?
I don't think, in my opinion, like the ideal of herd immunity was never that achievable. I mean, as you showed forward, I mean, here in the developed countries, about 100, there are about 100 doses per 100 people giving right now. I think right now we have 70% are covered of the ones who are eligible, but in other parts of the world, they have given 1.5 doses per 100 population. And as long as the majority of the world is poorly populated, there will be nothing even close to herd immunity, and this will. And I think for years there will be no herd immunity. So in the end, for the next months or even years, people who are not vaccinated, eventually they will become infected.
Dr. Niels Henning from Mount Sinai Global Health Center tonight. Dr. Henning, we appreciate your time and your insights. Thank you.
Thank you.